What are the, from I know you've written quite extensively, and definitely your friends. I think that's the easiest way of trying to put it. Your friends, who've taken the drug consumption. What are the basic arguments that are for and against it?
Against it, the argument is that you're seen to be giving people a safe space to use drugs, and that's frowned upon for some reason. We have drug consumption rooms on most. You can probably not walk 5 streets anywhere in a major city before you come to a drug consumption room. They're called pubs. Pubs are safe consumption spaces. You have stuff that's at a set quality. You're given it at a set dose. If it's deemed that you've had too much of that dose, then you're refused any more. And there's laws in place to make sure that everyone's safe as possible within that space. But once we start getting into the illegal drugs, then it's far more frowned upon. It's basically a fear of the Daily Mail, because you have these spaces that the only people that they would be benefiting are the most vulnerable people on the edge of society. So homeless people, people with enduring mental health problems, people with enduring drug problems, or young people who it's unsafe for them to do what they're doing in their home space because their parents would kick off. So instead, we force them to use the street. And you've seen some of the photographs I've taken of just around Birmingham, some of the places that people inject, and it's, you wouldn't wish that on anybody. The pro stuff is that in the UK, we're at our highest level of drug-related deaths ever. And I can say that now, and I could have said that to you last year, and I could have said it to you the year before, and we can go back to the last 5 or 6 years, and I could say it to you every year, because these drug-related deaths are growing. We're told by government that drug use is down, and the drug-related deaths this year are at their highest ever level. And they were at their highest ever level last year as well. And they were at the highest level at the year before, and the year before that, and the year before that. We're told by government that drug use is going down, and yet drug-related deaths are going up. So something's going wrong somewhere.
Yeah.
And we also, in the past few years, have had naloxone as a thing, which is an opiate antagonist that reverses overdose. So we're giving out naloxone that reverses overdose. We've got less people using drugs, but we've got more drug-related deaths. So there's something, the percentage of people dying is going up. Now, if you compare that street use and that home use to use in a drug consumption room, there's drug consumption rooms all around the world, and there hasn't been a single death from overdose in a drug consumption room ever. Part of that is because there's naloxone on hand, there's medical staff on hand sometimes, you have oxygen on hand a lot of the time. But at its very basic level, all we're talking about in a drug consumption room is a safe space and somebody there just to make sure that you're okay. Now, that could be what most people, I believe, think. I think if you went out into Birmingham tomorrow and asked people what a needle exchange does, a lot of them would think it was somewhere people took drugs. Already people think that, I think. And at its very basic level, that's all we need, is just a room with a clean area and somebody on hand to administer naloxone if somebody overdoses. That's all we're asking for when we're asking for a drug consumption room. We don't necessarily need, they're talking in Glasgow about, one with over £1 million spent on it, with nurses and doctors on hand and all sorts of stuff. We don't even need that. We just need a drugs worker with naloxone and maybe a bit of oxygen that they know how to use, and a clean surface that gets cleaned in between every person. And that's not even that hard now. We've got our heads around the idea of having clean areas between every person now. The joys of pandemic means that we're now used to cleaning down areas a lot more. So, we've already done that hurdle. Let's sort the other hurdle. And it's very annoying from a harm reduction point of view that this isn't something that is being just widely done.
So is this then, from the way that you're explaining it, in a great manner, is this more of a political decision rather than a health decision?
It's 100% political. If it was a health decision, they'd be open tomorrow. If it was a health decision, we'd have had them for years. It's purely a political decision because they see it as being political suicide to say that they're going to do something that allows people to use drugs. They didn't even like the idea of needle exchange back in the day. The government weren't, we did really well with needle exchange in the fact that we got an easy pass in the early days of it, but it wasn't that easy to get through in reality. It seems easy compared to things like the United States, where there was the ban on federal funding of needle exchanges, where people had to fight for stuff. But the advantage of them having to fight for things means that you've got some really creative projects in the United States. You've got projects that are funded by T-shirt sales, for Christ's sake. It's a different world.
And in your line of work as well, you get an opportunity to go around the world. Have you managed to actually visit a place where you've been abroad to, one of the drug consumption rooms? And what was the experiences like?
Yeah, I went and spent a couple of weeks. Well, I spent 3 weeks in Australia. In the first week I visited, there was a brand new drug consumption room that had been set up in Richmond in Melbourne. So I was there in its early days. I think it'd been open a couple of weeks. And that was really interesting to be there early on because you saw that it didn't have the community buy-in as much yet. Not just from the wider community, but from the drug using community in the area. So I have this photograph of the medical director's hands with some rubber gloves in. And it's him on his way back from reversing an overdose in a car park within sight of the injecting room because somebody was injecting in that car park. There's an injecting room there. So it's not this easy thing of, if you set up an injecting room, everybody will come and injecting it. You've got to build that community trust up. But then I went over to Sydney, and Sydney is probably the second most researched one. Insight in Canada is the most researched one because the national governments of Canada kept trying to shut it down. But Sydney's this amazing project. Marianne, that is the medical director there, had invited me down to Australia to sort of photograph it and spend some time there. And the thing that was different for me was you have a kind of image in your head of what something's going to be. And we have this image, especially in drug services, we have this image in our head that everything has to be like dour, sort of like, highly medicalized and stuff. And this is a place with nurses. This is a place with medical staff. It's, like I say, everything's cleaned down. But it was how relaxed it was. So if you think somebody's street injecting, they know that they've got a short amount of time and it could be a cop or a member of the public walking past at any point that's going to have a go at them. When you're in a place like this, you had people sitting and chatting while they were preparing their shot, having their shot. If they were having a problem finding a vein, they'd call over a nurse or something, and a nurse would suggest other possible routes in. Then when they'd had their shot, they'd go into this chill out area afterwards where they'd sit and they'd have a cup of tea and talk about, what changes they wanted to make. They could get referrals onto other services. But it was a happy, relaxed environment where there was no stress or worry about it. And I saw a few overdoses when I was there. So it's not that there are no overdoses in these places. There are overdoses. The difference is that when there's an overdose, everybody responds and everybody saves somebody's life. So I saw a few overdoses there, and the thing that got me was it was all perfect. It was all, right, we'll do this, blah, 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 right, they're breathing again, right, get them in this chair, we'll monitor them, you monitor him, we've got somebody over here that needs a bit of help as well, everything goes back to normal.